Hello, everyone, and welcome to Chapter 31, The Reproductive Systems. From this lecture, we will learn the following things: organs of the male reproductive system, including the locations, structures, and functions of each; causes, signs, and symptoms, and treatments of various disorders of the male reproductive system; organs of the female reproductive system, their locations, structures, and functions; and causes, symptoms, and signs, and treatments of various disorders of the female reproductive system. You will also learn the process of pregnancy, including fertilization, the prenatal period, and fetal circulation; the birth process, including the postnatal period; comparison of several birth control methods and their effectiveness; the causes of infertility and its treatments; and the causes, signs, and symptoms and treatments of the most common sexually transmitted infections. The male reproductive system consists of testes or testicles. The testes, commonly known as the testicles, are a pair of ovoid glandular organs that are central to the function of the male reproductive system. The testes are responsible for the production of sperm cells and the male sex hormone, testosterone. Testicles are divided into two sections, and each lobule is filled with seminiferous tubules. Spermatogenesis is the process of sperm cell formation. The structure of sperm cells consists of three parts, which are the head. The head of the sperm cell holds 23 chromosomes and is covered with the enzyme-filled sac, which helps penetrate the ovum at the time of fertilization. Midpiece. The midpiece of the sperm is filled with mitochondria to generate energy the cell needs to move. Tail. The tail is a flagellum that propels the sperm forward in the female reproductive tract. Internal accessory organs consist of an epididymis, which is located on the top of each testes and serves as the nursery for spermatids to mature into sperm cells. The vas deferens is a tube connected to each epididymis that carries the mature sperm cells to the male urethra. Seminal vesicles secrete an alkaline seminal fluid rich in sugars and prostaglandins. The alkaline mixture helps neutralize the acidic fluid of the female vagina. The sugars serve as energy, and the prostaglandins stimulate female uterine contractions to move the semen up into the uterus. The prostate gland also secretes an alkaline fluid, and during ejaculation, the muscular contractions of this gland help expel semen. Bulbourethral glands, or Cowper's glands, are below the prostate gland and produce a mucus-like fluid before ejaculation to lubricate the end of the penis and penetration for sexual intercourse. Semen is the total mixture of the sperm cells, fluids from the seminal vesicles, prostate gland, and bulbourethral glands. Nutrients and prostaglandins are included in semen. Each ejaculation has between 40 and 250 million sperm cells. The external organs of the male reproductive system includes the following: the scrotum. The scrotum is a pouch of skin that holds the testes. The scrotum insulates the testes from the rest of the body, keeping the temperature about 1 degree lower and allowing sperm cells to survive. The penis. The penis is a cylindrical organ that moves urine and semen out of the male body. The shaft of the penis is composed of erectile tissue. The end of the penis is enlarged into a cone-shaped structure called the glans penis. During the process of erection, the parasympathetic nervous system causes erectile tissues of the penis to become engorged with blood, which result in an erection. During orgasm, sperm cells exit the testes and move into the urethra. Secretions of the prostate, seminal vesicles, and bulbourethral glands are also released into the urethra to provide a medium for sperm cells to be moved forward. Ejaculation is the discharge of semen from the male reproductory tract, usually accompanied by orgasm. It is the final stage and natural objective of male sexual stimulation and an essential component of natural conception. Testosterone is the male reproductive hormone. It is responsible for the development of secondary sex characteristics such as chest hair, beards, and thickening of the vocal cords to produce a deeper voice than a female. Some of the most common diseases and disorders of the male reproduction system include benign prostatic hypertrophy. Benign prostatic hypertrophy is a non-malignant enlargement of the prostate gland, common in older men. The cause of BPH is related to hormonal changes which occur as part of the aging process. Common signs and symptoms of BPH include frequent or urgent need to urinate, increased frequency of urination at night, which is also called nocturia, difficulty starting urination, weak urine stream or a stream that stops and starts, dribbling at the end of urination, and inability to completely empty the bladder. A wide variety of treatments are available for enlarged prostate, including medication, minimally invasive therapies, and surgery. If symptoms are tolerable, one might decide to postpone treatment and simply monitor the symptoms. For some men, symptoms can ease without treatment. Epididymitis. Epididymitis is inflammation of an epididymis, most generally starting out as a urinary tract infection and then spreading upward. STIs, gonorrhea, and chlamydia are the most common causes of epididymitis in young sexually active men. Other causes can be an infection, urine in the epididymis, trauma, and tuberculosis. Signs and symptoms of epididymitis include a swollen red or warm scrotum, testicle pain and tenderness, usually on one side that usually comes on gradually, painful urination or an urgent or frequent need to urinate, discharge from the penis, painful or discomfort in the lower abdomen or pelvic area, and blood in the semen. Common treatments include antibiotics, which are administered for 4 to 6 weeks in chronic epididymitis and can include doxycycline and ciprofloxacin, pain medication, which can be available over the counter or can require a prescription. Impotence or erectile dysfunction. Impotence or erectile dysfunction, ED, is the inability for a male to achieve or maintain an erection strong enough to complete sexual intercourse. Causes can be physical or psychological. Treatment for impotence or erectile dysfunction includes ED surgery, vascular reconstructive surgery, which is one way to improve blood flow to the penis to help a man with erectile dysfunction get and keep an erection. Medications like Cialis, Levitra, Staxin, and Viagra are all used to treat ED. Prostate cancer. Prostate cancer is one of the most common cancers in men older than the age of 40. The cause is most commonly unknown. High levels of prostate-specific antigen are noted in the blood. The signs and symptoms include the following: frequent urination, weak or interrupted urine flow, or the need to strain to empty the bladder, the urge to urinate frequently at night, blood in the urine, blood in the seminal fluid, new onset or erectile dysfunction, pain or burning during urination, which is much less common. Treatments for prostate cancer include radiation therapy, brachytherapy, androgen deprivation therapy, orchiectomy, prostate biopsy. Prostatitis. Prostatitis is inflammation of the prostate gland. It is caused by excessive alcohol consumption, bacterial infection, or trauma to the urethra. The signs and symptoms of prostatitis include painful, difficult, and/or frequent urination, blood in the urine, groin pain, rectal pain, abdominal pain and/or lower back pain, fever and chills, malaise and body aches, urethral discharge, and painful ejaculation or sexual dysfunction. For treatment, you will likely need to take oral antibiotics for 4 to 6 weeks, but might need longer treatment for chronic or recurring prostatitis. But if you have severe symptoms, you might need intravenous antibiotics. Testicular cancer. Testicular cancer is a malignant growth of one or both testicles. It is not clear what causes testicular cancer in most cases. Certain factors may include family history, age, race, etc. Signs and symptoms include a painless lump or swelling on either testicle, pain, discomfort, or numbness with or without swelling in a testicle or scrotum, change in the way a testicle feels or a feeling of heaviness in the scrotum, dull ache in the lower abdomen or groin, sudden buildup of fluid in the scrotum, breast tenderness or growth. Medical treatments of testicular cancer include retroperitoneal lymph node dissection, bleomycin, etoposide, and cisplatin. The organs of the female reproductive system include ovaries. Ovaries produce the female sex cells and the female hormones called estrogen and progesterone. They are located in the pelvic cavity. Oogenesis is the process of ovum formation. Ovulation is the process in which an oocyte is released from an ovary each month after the female has reached childbearing age. The mature ovum contains 23 chromosomes, and when it combines with the sperm cell, the resulting cell will contain 46 chromosomes. Internal accessory organs of the female reproductive system include fallopian tubes, infundibular. As mature oocyte is released from the ovary during ovulation, the infundibulum, fringed expand end of the fallopian tube, is prepared to catch the egg cell and propel it towards the inside of the fallopian tube. Uterus. The uterus is a hollow muscular organ that receives a developing embryo and sustains its development. The inner lining of the uterus is vascular with a rich blood supply. The middle portion is a thick muscular layer, and the outer layer secretes serous fluid to coat and protect the uterus. Vagina. The vagina extends from the uterus to the outside of the body. Muscular folds called rugae allow for expansion to receive an erect penis during sexual intercourse, as well as to provide an adequate passageway for delivery of an infant. External accessory organs of the female reproductive system are the mammary glands, which secrete milk to nourish a newborn child. Mammary glands are located beneath the skin in the breast area. The pigmented area surrounding the nipple is called the areola. Milk production is stimulated after childbirth by hormones prolactin and oxytocin. External genitalia of the female reproductive system consist mainly of the labia majora and the labia minora. The labia majora are composed of adipose tissue, which protect the other external female reproductive organs. The labia minora are inside the labia majora and form a hood over the clitoris. Bartholin's glands secrete mucus into the area during sexual arousal to allow smoother insertion of the penis into the vagina. The clitoris contains the female erectile tissue and is rich in sensory nerves. The perineum is the area between the vagina and the anus. While this area was traditionally clipped during childbirth in the procedure known as an episiotomy, a new approach is to avoid cutting the area unless the baby is unusually large, in an abnormal position, or needs to be delivered quickly. During sexual arousal, stimulation causes the clitoris to become erect and the Bartholin's glands become active. If the clitoris is sufficiently stimulated, orgasm occurs. Walls of the uterus and fallopian tubes contract during orgasm and help propel sperm toward the upper glands of the fallopian tubes. Female reproductive hormones. Beginning at puberty, the hypothalamus secretes increasing amounts of hormones to cause the ovary to produce estrogen and progesterone, which are responsible for the female secondary sex characteristics of breast development, increased vascularization of the skin, and increased fat deposits in the breasts, thighs, and hips. Female reproductive cycle. The first menstruation cycle is called the menarche. Menopause is termination of the menstrual cycle because of the normal aging process. Hormonal changes occur in a progressive manner each month to culminate in menstruation if the egg has not been fertilized. Some of the most common diseases and disorders of the female reproduction system include breast cancer. Breast cancer is the second leading cause of cancer deaths in women after lung cancer. Causes are largely unknown but may be related to hormonal changes or to the presence of certain genes. Symptoms of breast cancer include swelling of all or part of the breast, even if no distinct lump is felt, skin irritation or dimpling, sometimes looking like an orange peel, breast or nipple pain, nipple retraction, turning inward, and redness, scaliness, or thickening of the nipple or breast skin. Treatment for breast cancer include chemotherapy, radiation therapy, and breast surgery. Cervical, uterine, ovarian cancer. Cervical cancer generally develops slowly and can be detected by a pap smear. A weak immune system may be a factor in the development of this cancer. Uterine cancer is most common in postmenopausal women. The cause is mostly unknown but may relate to increased levels of estrogen. Ovarian cancer is the most serious of the cancers affecting women, since signs and symptoms are not detected until the disease is too far advanced to contain. Causes are unknown, but the presence of certain genes has been indicated as a risk factor. For treatment, sometimes the ovaries and fallopian tubes are removed. In addition, lymph nodes near the uterus may be removed to check the spread of the cancer. Hysterectomy is also sometimes done to prevent spread of the cancer. Radiation therapy or radiotherapy is also used to treat cervical cancer at some stages. Dysmenorrhea is also known as painful periods or menstrual cramps. Its usually onset occurs around the time that menstruation begins. Symptoms typically last less than 3 days. The pain is usually in the pelvis or lower abdomen. Non-steroidal anti-inflammatory drugs are the most common treatment for both primary and secondary dysmenorrhea. They decrease menstrual pain by decreasing intrauterine pressure and lowering prostaglandin levels in menstrual fluid. Endometriosis and fibroids. Endometriosis is an often painful disorder in which tissue that normally lines the inside of your uterus, the endometrium, grows outside your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissue lining your pelvis. Treatment includes laparoscopy, hysterectomy, and an oophorectomy. Uterine fibroids are solid tumors that, although usually non-cancerous, can still cause a great deal of pain in the uterus and pelvic region. Some women have these fibroids but have no symptoms, while other women suffer from extreme discomfort if they have uterine fibroids. Treatments include uterine mastectomy and uterine artery embolism. Fibrocystic breasts are characterized by lumpiness and usually discomfort in one or both breasts. The lumpiness is due to small breast masses or breast cysts. The condition is very common and benign, meaning that fibrocystic breasts are not malignant or cancerous. Most women who have fibrocystic breasts don't require invasive treatment. Home treatment is usually sufficient to relieve associated pain and discomfort. Over-the-counter pain relievers such as ibuprofen and acetaminophen can usually effectively relieve any pain and discomfort. Cervicitis. Cervicitis is inflammation of the cervix, the lower end of the uterus that opens into the vagina. Cervicitis is common. It may be caused by a number of factors, including infections, chemical or physical irritations, and allergies. Many women with cervicitis don't have any symptoms. The condition may be discovered only after a routine exam or test. Signs and symptoms, if present, may include grayish or pale yellow vaginal discharge, abnormal vaginal bleeding, such as bleeding after sex or between periods, pain during sex, difficult, painful, or frequent urination, pelvic or abdominal pain, or fever in rare cases. You may not need treatment for cervicitis if a sexually transmitted infection is not the cause. If an infection is suspected, the main goal of treatment is to eliminate the infection and prevent it from spreading to the uterus and fallopian tubes, or if you are pregnant, to your baby. Depending on what organism is causing the infection, the doctor may prescribe the following: antibiotics, antifungal medications, and antiviral medications. Premenstrual syndrome, PMS. Premenstrual syndrome is a collection of symptoms which occur just before a menstruation period, including anxiety, depression, irritability, acne, fatigue, food cravings, bloating, headache, abdominal pain, breast tenderness, weight gain, and loss of sex drive. Selective serotonin reuptake inhibitors, which include fluoxetine, Paroxetine, sertraline, and others have been successful in reducing mood symptoms. SSRIs are the first line of treatment for severe PMS or PMDD. These medications are generally taken daily. Vulvovaginitis and vaginitis. Vulvovaginitis and vaginitis are both inflammations and can be associated with abnormal vaginal discharge. The condition is usually caused by yeast infections, tampon use, or poor hygiene. Vaginitis can be prevented through good hygiene and safe sex practices. Fertilization. During sexual intercourse, the male deposits semen into the vagina. Sperm cells must travel through the uterus to the fallopian tubes to fertilize a waiting ovum. Although many sperm cells reach the correct area, only one sperm enters the ovum. A combination of 23 chromosomes from the ovum and 23 chromosomes from the sperm cell will unite and form a new cell called a zygote. The prenatal period, blastocyst to embryo. One day after the zygote forms, mitosis begins at a rapid rate called cleavage. A resulting ball of cells called morula travel down the fallopian tubes to the uterus, where it becomes a blastocyst and implants in the endometrial wall of the uterus. After a period of approximately 1 week, the cell becomes an embryo. During the prenatal period, the following occurs. Placenta is filled with amnion. The placenta is an organ that develops in the uterus from the blastocyst. The placenta provides oxygen and nutrients to the growing baby and removes waste products from the baby's blood. The placenta attaches to the wall of the uterus and the umbilical cord arises from it. In most pregnancies, the placenta attaches to the top or side of the uterus. The amnion is a protective, fluid-filled sac that surrounds the embryo. Embryonic period. The embryonic period spans from the second week of pregnancy to the end of the 8th week. Cells of the inner cell mass organize into layers called primary germ layers, from which all organs are formed. Fetal period. The fetal period, when the offspring is called a fetus, spans from the end of the 8th week to the development of delivery of the newborn. Fetal circulation. Fetal circulation takes place between maternal and fetal blood. A fetus growing inside the mother's womb does not use its lungs to breathe until birth, so its circulatory system is different from that of a newborn baby. Instead of the lungs supplying the oxygen-rich blood to the fetus, the fetal heart has an opening between the upper chambers called the foramen ovale. The ductus arteriosus is a blood vessel connecting to the aorta and the pulmonary artery to carry blood away from the heart in the developing fetus. In fetal life, the ductus venosus allows variable portions of the umbilical and portal venous blood flow to bypass the liver. Hormonal changes during pregnancy. Many hormonal changes take place when a woman is pregnant. Embryo cells secrete human chorionic gonadotropin, which stimulates the corpus luteum to continue to secrete estrogen and progesterone. The placenta also secretes estrogen and progesterone, which stimulates the uterine lining to thicken. These hormones also stimulate development of the mammary glands, inhibit uterine contractions, and stimulate enlargement of female reproductive organs. Relaxin is secreted to relax ligaments of the pelvis. The placenta secretes lactogen, which stimulates enlargement of mammary glands. Aldosterone is secreted from the adrenal glands, which increase sodium and water retention. Secretion of parathyroid hormones increase and make sure high calcium levels of the blood are maintained. The birth process. The birth process ends pregnancy. The process begins when progesterone levels fall and uterine contractions begins and oxytocin is once again released. The cervix thins and softens, known as effacement, and cervical dilation to 10 centimeters allows for a large enough opening to deliver an infant. Expulsion is also known as parturition, and forceful contractions force the fetus from the uterus to the vagina. The placental stage occurs as the afterbirth separates from the uterine wall and is expelled. The APGAR test is a simple assessment of how a baby is doing at birth, which helps determine whether your newborn is ready to meet the world without additional medical assistance. It is done twice, once at 1 minute after delivery and again after 5 minutes to assess respiratory effort, heart rate, skin color, reflexes, and muscle tone. The postnatal period is 6 weeks following birth. The first 4 weeks are called the neonatal period, and the offspring is called a neonate. After childbirth, prolactin causes the mammary glands to produce milk. If the mother does not choose to breastfeed, the hypothalamus will inhibit the release of prolactin and oxytocin, and milk production will stop. Contraception. Complete abstinence is the only sure way to prevent pregnancy. However, the rhythm method is sometimes effective with periodic abstinence on days believed to be the most fertile. A woman with a regular menstrual cycle has about 9 or more days each month when she is able to get pregnant. The fertile days are about 5 days before and 3 days after the ovulation, as well as the day of ovulation. Coitus interruptus method, or withdrawal of the penis from the vagina prior to ejaculation, also will sometimes be effective. Barrier methods include the following: condoms, contraceptive sponges, diaphragms, cervical caps, and shields. Hormonal methods include oral contraceptives, also known as birth control pills. Hormonal methods may include the patch, injections, and the vaginal ring. Insertable contraceptives are in a form of implantable devices, including rods and intrauterine devices. Contraceptive implant is a tiny thin rod about the size of a matchstick. It's also called Nexplanon, and there's a slightly older version called Implanon. A doctor inserts the implant under the skin of your upper arm and releases the hormone progesterone to stop you from getting pregnant. The transdermal contraceptive patch is a safe, simple, and affordable birth control method that you wear on the skin of your belly, upper arm, butt, or back. Put a new patch on every week for 3 weeks, and it releases hormones that prevent pregnancy. Then you get a week off before you repeat the cycle. An intrauterine device, or IUD, also known as an intrauterine contraceptive device, or coil, is a small, often T-shaped birth control device that is inserted into a woman's uterus to prevent pregnancy. IUDs are one form of long-acting reversible birth control. A permanent birth control method is surgical sterilization. Surgical sterilization is a safe, highly effective, permanent, and convenient form of contraception. The most common surgical sterilization procedure in women is called a tubal ligation, or having the tubes tied. The fallopian tubes are the passageway for the egg to travel from the ovary to the uterus, and hence when tied or blocked, they provide effective contraception. Emergency contraception in the form of the morning after pill is also available over the counter for women over the age of 17 years old. Infertility. Infertility is the inability to conceive a child. In the United States, 15% of causes are unknown. 35% of causes are related to the male partner, and 50% of the causes are related to the female partner. Infertility tests related to the male partner include a semen analysis to check the number of motility of sperm. Testosterone levels can be measured. There are many more infertility tests related to the female partner, from simple methods such as taking a morning body temperature to more complex and invasive measures. Blood and urine can be analyzed for hormone levels. Biopsy of the endometrium tissue, laparoscopy, and X-rays are more intensive tests. Hysterosalpingography is also known as uterosalpingography. It is a radiologic procedure to investigate the shape of the uterine cavity and the shape of the patency of the fallopian tubes. It injects a radio-opaque material into the cervical canal and usually fluoroscopy with image intensification. Treatment for infertility will be related to the results of testing. Surgery may be needed to repair abnormalities. Fertility drugs or hormone therapy may help as well. Procedures such as artificial insemination, in vitro fertilization, or use of a surrogate may help a couple have a child. The most common sexually transmitted infections occurring in both sexes include AIDS, acquired immunodeficiency syndrome. AIDS is caused by a virus and transmitted through sexual activity. Chlamydia. Chlamydia is the most common reported STI in the United States. There are often no symptoms until the disease has spread. Genital warts are also known as condyloma acuminata. The STI is caused by human papillomavirus. Don't try to treat genital warts with over-the-counter wart removers. These medications are intended for use in moist tissues of the genital area. Using over-the-counter medications for this purpose can cause even more pain and irritation. One may need surgery to remove larger warts warts that don't respond to medications, or if you're pregnant, warts that your baby may be exposed to during delivery. Gonorrhea. Gonorrhea is a bacterial STI with a white, greenish, or yellowish discharge noted. The recommendation treatment for gonorrhea are antibiotics administered as an injection. Herpes simplex includes type 1, which causes oral blisters known as cold sores, and type 2, which is known as genital herpes. Pubic lice. Pubic lice are commonly called crabs and are caused by parasitic infestation in the genital area, most commonly spread through sexual contact. Syphilis is a bacterial STI which begins with a painless sore known as a canker at the first stage. The second stage is characterized by a rash and lesions in the mucous membranes along with flu-like symptoms. Often years later, the third stage becomes apparent with brain damage accompanied by eye, heart, blood vessel, liver, and bone involvement. Trichomoniasis is a common curable STI caused by a parasite. Trichomoniasis can be cured with a single dose of prescription antibiotic medication, which can be taken by mouth. It is okay for pregnant women to take this medication. That concludes today's lesson. Next, we will be going over assisting with urology and reproductive systems.